The next subtopical area, the thematic focus was on mental health. And in mental health, we have two trailblazers, two young people who are doing amazing work in their different spaces with the focus on how they can improve mental health of the communities and promote discussions around mental health, because these are topics that we all acknowledge. There's some kind of a taboo that has been there in terms of people talking about mental health. And with this, access to care becomes a challenge because nobody is willing to talk about it. Unless we identify the challenges that we have, we might not be able to move from a point of identifying it to solving the problem. So that's a very critical thing. So our next speaker will be Damian Juma. Damian Juma runs an organization called MyMindOurHumanity, which has a focus on improving discussions, promoting discussions around mental health, and giving social support groups to the young people. So I'll hand over to you, Damian Juma, from there.
Hi, yeah, thank you so much for the wonderful talk on Newton. I was unable to do that because you had to unmute me from your end. Thank you for the space, and thank you for everybody who made time to join us today, and a very warm welcome, and thank you. My name is Damian Juma, and we work with MyMindOurHumanity. It's a global campaign that focuses on mental health, both on online and offline activities. And here, look, I'm going to talk about what we've done locally and then regionally or globally. Here in our country, we thought about how best to involve university students and college students in this mental health conversation. Our major focus is on young people, not because we disrespect the old people or we disrespect the old folks, but we thought maybe by curbing or by utilizing the power that young people have and the energy that they have, and to educate them on matters mental health, it will be invaluable for them going forward because the young people are going to have families in the future. Families of their own, and these young people come from a family. So if we thought that if we make it a habit for them to acknowledge that mental health is important, then indirectly we are empowering a society. We're empowering the families. We are empowering the families that they are gonna bring up, and we're also empowering themselves. So we began by having a launch on the 7th of June in 2019 in Moi University School of Medicine. And we asked young people how best we can do this. We do this work collaboratively with young people. So we don't go to an institution and ask them to impose what we think is right for them. We go to an institution and ask them what's the best way that we can do all this work together. Because we believe that young people, as much as they have the energy, they have the time, they also need the sense of belonging. They need to own some of these campaigns because it beats logic for you to tell people what to do, and they know what best suits what suits them best in their setting. So far, we've had 3 events. One in Moi, like I said, on the launch. The second one was in Alto College, and the third one was in Busia, Alupe University. That's when we were living in a normal world. And after 2019 and the normal world came in, we had some webinars on WhatsApp and on Zoom, which we also realized that young people here locally, they actually like WhatsApp because 1, it's affordable, 2, it's easy to use and it's convenient as expected to Zoom. That's actually a result of the survey that we ran. And I would request that, if going forward, if some of you guys are planning to have something, I think it's also important to, to make it concurrent or even choose WhatsApp more often as compared to Zoom. Not because we wouldn't want or you don't want this kind of engagement, which is always favorable, but because you need to reach those young people who cannot be able to be on Zoom, who cannot be able to afford to be on Zoom. And these events that we carry out as MyMindOurHumanity, they're events that embrace music, they embrace art, they embrace poetry, spoken word, drama, and most importantly, lived experience. So we ask young people to co-create these spaces. We ask young people to share their experiences in these creative ways, and that pulls young people together. That makes the session interesting, and as much as we are having fun, we are learning a very important key aspect of our lives, of how we can be able to be mentally aware, mentally okay, or mentally stable, or how best we can be able to even support those of us who are living with mental health conditions, or how best you can be able to be good carers of those people who are living with these conditions. And from these 3 events, we've had more than 700 attendees, who are major part of those young attendees are young people from universities and colleges. And from the survey that we ran, 97 of these young people would like to see more of these events, more of these physical events. And awesome was the most term used to describe those events, with the mental health lived experience stories, which I often call resilience stories, being the most liked part of the event, because young people the stories resonated with young people. They felt stories are very powerful, and they felt more impacted by those stories. And I guess that's that's why it was most liked part of the event. Next slide. So I'm sure many of you are asking, what's MyMindOurHumanity? Where did it come from? And I've been talking about the activities that we've done as the Kenyan hub of MyMindOurHumanity. So MyMindOurHumanity is on Instagram, and we have over 22.2K followers. And MyMindOurHumanity was born in 2018 in a summit in London, where the Lancet Commission on Global Mental Health thought that it was very important for them to involve young people, to disseminate the findings and be part of the research and be part of the conversation. So that's when the MyMindOurHumanity campaign was formed, and we actually created this campaign from scratch. And this is in collaboration with various young leaders from around the globe, but majorly from Africa. We have young leaders from Rwanda, Nigeria, Liberia, South Africa, Zimbabwe, Portugal, UK, US, and the Caribbean. And actually, with this pool of very influential and great young people, we created this MyMindOurHumanity campaign, particularly to be able to, one, spearhead online campaigns on mental health, especially on Instagram, and soon we'll be able to be on Twitter. And two, to be able to carry out some of those activities in our own countries. And for our own country in Kenya, I have just said what we've done. And this campaign has 3 objectives: to educate and inspire young people to act to promote well-being in their own communities. So that's why we are moving into institutions and asking young people to be able to be our own champions, or their own champions in their own communities, because we realize we can't reach every community. But when we go to an institution of young people, these young people can be able to help us reach their own communities, and then in so doing we have a bigger reach to promote the mental health of the view of mental health as a fundamental part of being human. This is why we want to involve resilience stories. And when we talk about involving resilience stories, we don't mean that you just come and share your story and then you go. No, we mean that your story is very important, and your story is part of the bigger impact that we are about to create. And we don't force you to do it. We ask you to do it, not because we want you to put your story in the open, but because we need those people who are out there who do not believe in one way or the other that mental health is important, to realize that they are missing the point, they are missing the concept, and they are missing the major part of well-being, which is our mental well-being. And lastly, to integrate the mental health voices and experience of young people into the public health debate. This is what we've done. We've shared some of our recommendations, which I was very happy to see they have been included in the task force that was released recently, the mental health task force. We have gone into conferences to talk about how best young people from our country in Kenya can be able to be involved and globally. And we've also had space to share or to be part of policy documents, to draft some policy statements that have gone ahead to be really important and influential in policy making tables. And like I said, we live by the fact that you don't ask people what's the matter with them, but rather you ask what matters to them. You know, what really matters to you is important than what's the matter. And we've had a series of bespoke campaigns materials produced in different languages, in Swahili even, English, Portuguese, Arabic, so that everybody, or at least everybody, we can't like reach the whole world, but at least the majority part of young people can be able to feel part of this campaign, to belong in this campaign, and to participate in the best ways possible that they can. Next slide, please. Now, what are the next steps? What are we thinking next with the abnormal world that we are living in? Definitely, the physical events have been put on hold, and online events. At times, we've had them before, but we couldn't continue because of various reasons that we realized we really use young people's time. We spend with them online, but we really were unable to find the best way that we could reimburse them for their airtime or for their bundles because of different international regulations, especially from the University of Oxford, where the MyMindOurHumanity headquarters are. So by so doing, we were unable to do that. But in collaboration with the International Mental Health Association, IMA, I'm going to have like the website on the chat right now if you want to check it out. It's a new organization, and we are planning to have a locally co-designed program for young people between the ages of 18 and 25. And we pilot this program in the coastal counties. Coastal counties here means Mombasa, where I'm calling in from right now, Kilifi, Kwale, Lamu, and Taita Taveta. And we are planning to train 15 to 30 young people, between 15 to 30 young people in all these sub-counties on mental health basics and how to improve their resilience. And also see whether that program is actually effective, and then we can be able to roll it out to more diverse Kenyan young people and to different settings and to different counties and cities. So what would really want to ask from this, and we are calling this project We Live For Us, by the way. We live for us as young people because we want to embrace the culture that we are not living for our moms, we are not living for our brothers, or we are not living for our sisters and our parents. But first, we are living for us. For us to live for ourselves, we need our mental well-being to be in check. We need to embrace our mental well-being. And we also need to embrace our mental health issues. We need to seek help. We need to acknowledge the fact that, health without mental health is not actually universal. We can never achieve the universal health coverage without without us being mentally healthy or mentally aware with the mental health issues, or how to embrace mental well-being. And that's how we call the project We Live For Us. And what we need from you all is, if you have implemented such programs before, what were the lessons that you learned? And what would you want us to do better? And also, we are in the initial phases of planning this. So if you're interested in being part of this, creation, or to co-create this program, please reach out to us and tell us, how best we can be able to do that, and how best we can potentially collaborate. Thank you so much. And my email address is just right there if you wish to reach out, or you can reach out to David or Ryculture as our team, and they'll definitely get to us. Thank you so much for listening to me, and I wish you have a beautiful day. But if you have some questions, I'll be very happy to address them. Thank you.
Thank you so much, Damian. That was a very wonderful presentation on the work that you're doing in mental health, engaging young people and looking at it from a perspective of bringing the very people who might need that support and helping them take responsibility. That's a very amazing work. In case anyone has questions, our chat box is still open, so please share them. Damian will respond to you. So next, we'll move to the next presenter. That is John Mwangi, voice of Dago. So John Mwangi.
Good morning. Can you hear me?
Yes, we can.
Okay. Good morning, guys. So, yeah, my name is John Mwangi from Voice of Dagureti. I'm the chairperson. I'm here to present a little bit about Voice of Dagureti and what we have been doing about mental health. First of all, Voice of Dagureti is a youth group which was formed back in 2017. We have worked with in the community for the last 4 years. So our vision is to create a world where youth realize their full potential. So we want to involve youths and we want them to have the ownership. Our mission is initiating social and economical sustainable avenues for the youth and members. So we have worked with various groups and we have done various projects and objectives as a group. So Voice of Dagureti is, we are located in Dagureti sub-county. We serve both Dagureti North and Dagureti South. We have worked with various youth groups in Kibera, in Mukuru. So for us, we target here in Ghetto, sana Ghetto, because unlike Odhiambo, his organization works a lot in university. We really do try to reach people in Ghetto because we have a lot of pressure here. People don't know about mental health. So kindly go to the next. Okay. So organization experience, we have done a lot as a group. We have done rehabilitation of the youth previously engaged in risky behaviors. As we know, in Dagureti or in Nairobi, the rate of crime is very high. But if we don't rehabilitate this youth, so it's very difficult. And then so we have created avenues for income generating activities, that is theater. So as Voice of Dagureti, we do theater, we do magnet theater, we do awareness through that. We go to the marketplace, Kwasoko, in the community, and then we do small skits which we engage the community. And then after we have done the skits, people give us their feedback. So we are still advocating for mental health issues in Dagureti sub-county. Like in Dagureti or in Ghetto, people don't know about mental health, so they don't think it's something serious. Most of them think like in kama tu wazimu, they don't think it's something that can be taken seriously. So we also create awareness on various issues that are affecting our community directly or indirectly. So we have GBV, mental health, STIs, equality, and children's rights. We do that advocacy still through magnet theater, and then we also do a community forum where we discuss with the people, with the members of the community. We really engage youths and their parents. Mostly we do like to talk to the parents and the youths. We let them come together and sit and talk together. And we have worked with various NGOs, government, community, and all well wishers from Dagureti. So kindly go to the next. So the best practice that should be adopted and emulated on mental health. We as Voice of Dagureti, we have sat down with various youths from Dagureti, and they gave us some ideas which we thought is they can work if they this practice that should when we adopt these practices. So we do community awareness on mental health is very important. I believe people don't know about mental health. they don't have the information. So if they don't have the information about mental health, so it's very hard for them to know anything about mental health. So and then we have to create safe space for the affected young people. So like in Dagoretti, we have one youth-friendly services that serves the youths, and it's very far from Dagoretti. So if we don't have a safe space where we can engage these youths, it's very hard for them to come up and talk to people about their issues. So and then we have community events and campaign on mental health. We need to work on this very much, because if we this is part of community awareness. We have to come up with events and campaigns on that, so to create awareness. And then we have parents and the youth discussion regularly. I believe youths are in the ghetto or in slums. Most of them, they don't talk with their parents. They are not in good terms with their parents. So this leads to depression. Sometimes they don't know who to talk to. So in previous last month, we came with a project. So we brought some parents and the youths. So a discussion. It was very hot discussion. So and we realized that parents and the youths they are not in one mind. So the parents think that the youths are very rebellious, and the youth think that the parents, they cannot understand them. So I thought that in Nairobi we need to really create the discussion with parents and the youth. And then so we have to have active youth-friendly services. So if most of them, these youth-friendly services are from the government, and as we know, most of them are not that active, and they don't open on time. The people who are supposed to serve the youths, most of them, they are old people, but I don't disrespect the old people. But so you see the youth, they feel very uncomfortable opening up to maybe to an older person, like maybe they think they will be judged. So if we have an active youth-friendly services that can be run by youths, I think the government can create a training on youths, and maybe they can post them in different youth-friendly services in Nairobi. Like I said earlier, in Dagoretti, we only have one in Waitaka, and the other one in Kawangware, and they are very far. So there is a place called Kabiria and Ngando. So those places, they don't have youth-friendly services. So and these places are very highly populated with young people. So I think if we create one in Ngando and Kabiria, that will be very important. And then so next, please. And then how the policy can enable the adoption, uptake, and scale up the related youth initiative in area. So this means how can youth own this project? How can they feel that they are part of this? First of all, involving the young people in government and decision making. We say, like, as young people, we have this saying that nothing for us without us. So it's very hard for some people to go and create rules for youths and bring them bring them here, and then they just want them to follow. So if we involve the youths in decision making and community forums, that will be very important. And then we have creating youth-friendly services, I said earlier, and then we have to creative centers like social hall for youths, where they can be creative, they can be given a chance to do to express themselves, maybe through art, through craft. I think that is very important, because if youth meet together, they can be creative, they can come with their own solution, because as youth, we know our own problem, and then we also have our own solution. So I think that is very important. And then we have youth group empowerment project, environment project. So we have many youth group in Nairobi and in Kenya, and most of these youth group are not empowered; they are just left there. So I think if the government the government, if they can come up with a strategy that which they can empower this project, this youth group, it can be very important. Youth, they like to be involved in things. They don't. I really do like to be involved. Especially me, John Mwangi, I like to be involved because I feel like I'm the part of this. So if we can if you can do that, if the government can do that, it can be very important to the youth. So, and then lastly, the support that we as the Voice of Dagoretti and we have like 6 groups which are registered under the Voice of Dagoretti, and we really do community awareness. So the support we really wish to venture into more community awareness activities and try as much as possible to help in raising cases of teen pregnancy and mental health. In Dagoretti, in the previously research that Dagoretti was very high in teen pregnancy. It was the second sub-county in Nairobi. Mental health, Dagoretti is very high. Gender-based violence is very high, but mostly like for now we are talking about mental health. Mental health is very high in Dagoretti because we don't have maybe people who we can approach. We don't have friendly services where we can go and maybe talk our issue. So we reach a small crowd sometimes, but we don't reach the bigger crowd. So we came up with a solution. If we could get maybe a sound system and a tent, we can reach a very large crowd at a very small time, because we need to reach as many people as possible, because we have Kona Soko, we have a marketplace, we have a matatu place where we can reach there. So I think if we can get maybe a sound system and tent can be very helpful, and we would like to work with various organizations that have the same goal. When I mean this, I mean like, if we can have a support, or when the youth have something or they have someone who can back them, they will feel that they are not alone in this. They will have the courage to do that. So if we could get organizations that have the same goal and to create awareness in the community, that can be very helpful. Thank you very much.
Yeah, so sorry. Thank you so much for asking those very many questions. I'll just like go through some of them. Sorry if I miss, if I happen to miss your question, I'll be happy to, like, David, could you just please help me to see whether I've missed one? So apart from the use of the media talk about mental health, have you thought of using art to pass message on the on the same, something like edutainment? Thank you so much, Amol Chesaumu, for asking that question. And I think I talked about us using dance, poetry, music, and drama, and most importantly, the experience resilient stories. So I think it's visual arts and auditory arts, if I'm not wrong, but I think they do fall under the arts section. And also, like, young people can just come up with a spoken word about depression or about their story, their lived experience story, and they do share. I tend to think that that's auditory, what do they call them? Auditory artifacts or visual or something like that, or performing. Another question will be, let me see. Also, when will the program of training young people around Kilifi, Mombasa, and Kwale start? I'm interested. Thank you so much, Grace Nyale, for that. We are in the very initial phases of planning this, so I'll say that it's a good time for you to come in and shape this and be part of this. So like, we are not asking, or we are not developing something for the young people, but then we are developing something with the young people. I can't give you a timeline particularly, but maybe next year, like by the quarter of next year, we'll maybe have started rolling out the program. And there's somebody who asked why the coastal counties. We like I said, this program is just starting here. It's a pilot program, and we want to see whether it actually works. So we don't wanna put too much on our table by saying, we are rolling this thing in the country, in the whole of Kenya, and we can't live with that. Like, we can't live by that. We're just asking that, we test this thing out, we see whether it actually works. And then after we know for sure that this thing works, then we're going to be able to implement it in other counties. And like I said, we are not training like every young person, but we are we are targeting these, UO advocates, from reproductive health advocates to gender-based violence advocates to social welfare advocates, to everybody, so that these advocates can be able to also understand what mental health is, and then when they go back to their own respective advocacy areas or championship areas, they can be able to be a mental health advocate as well, because like every aspect of life affects mental health. Like the welcome model says, mental health is not only a scientific issue, it's a social issue, it's an economic issue, it's an equality issue. So literally mental health touches on almost everything. Let me see. Okay, Damian, how is the training being conducted? Are there counselors on board? Are you open to any collaborations? Yes, we are, like I said, we are in the initial phases of planning this. So we are very happy to bring people on board, people who are interested and people who will make us realize this vision. And how it will be trained, it will be, we are thinking of a 1 week training in each of those 5 counties, and then it's our belief that the trainees can be able, it's more of a trainers of trainee program. The trainees can be able to also talk about mental health in their respective areas of championing on mental health. Just a quick ask, David, whether I've missed some important question that I need to answer really. If you're interested, really, reach out to David, because like he's the one who brought us up together. Or you can also reach out to me via the email, and then we can see next steps, how they go. I'm sorry if I missed your question, please. It will be very helpful if you can just raise it, and I'll be happy to answer. And thank you so much for the voice of Dago and Newton for the wonderful talk. I'm really glad that you're doing that in a very under-resourced setting in Dagoretti. That is really good.
Thank you so much, Damian. Hello,
Hi,
can you hear me?
Yeah, thank you.